And there is no question tonight, McKinley County is our biggest concern with the spread of this virus here in New Mexico. Every day we are seeing dozens and dozens of new cases in a county with just around 70,000 people. And today was no different. 43 new cases. McKinley County still has the highest positive result rate in the state, 17.1% tonight. 820 cases out of nearly 4,800 tests administered. You break it all down, folks, it's about one case for every 89 people in McKinley County. Nearly 60% of the cases are on the Navajo Nation. But in just a week's time, folks, our friends in McKinley County have had more than 400 additional cases of COVID-19. That's nearly 40% of all the new cases we have seen statewide in the last 7 days. So how are doctors in McKinley County doing with this influx? We know Gallup is a medical shortage area, and it really has been for some time. Some doctors there have had to go outside their specialty because of this pandemic. Joy Wang actually caught up with one today and joins us in our newsroom with his experience with this COVID-19. Joy.
Well, Tessa, Dr. Jim Whitfield is a kidney specialist in Gallup, and he was supposed to retire this year. But because of COVID-19, he's pushing that off. He says kidney disease across McKinley County is 5 times the national average. Many patients also have other underlying conditions like obesity.
The biggest cause of kidney disease in our area, in fact, well over 90% of our patients, the underlying cause is diabetes. And by the time a person develops end-stage kidney disease from the diabetes, they also almost universally have heart disease. Most of the patients have high blood pressure. Most of the patients have vascular disease associated with their many years of diabetes.
And all of those things you just listed are also underlying conditions that could affect patients who contract COVID-19.
Exactly. If we look at the statistics nationwide, hypertension and obesity and heart disease are the 3 #1 causes of mortality related to COVID disease. So now you've taken a population that almost by definition, if they're going to get coronavirus infection, they have oftentimes all 3 of those along with the kidney disease.
Those underlying conditions make COVID-19 even more deadly, which brings us to what Dr. Whitfield says is the biggest challenge. In his 38 years practicing medicine, he's always been able to comfort patients and their family members, but not now.
Part of medicine goes beyond science. And the ability to try to make that passing a little less traumatic, I think that's part of what a doctor does. You can't do that anymore. Not only can the family not see the patient, the doctor can't be with the family and try to be a comfort to those who will be living. That has changed.
Tomorrow night, you'll hear from Dr. Whitfield again, this time about testing and why a delay weeks ago is affecting their cases now. Tessa?